From Dose of Health, this is Abhishek, a specialist pharmacist currently working within the NHS in the UK. It was 2016. In a quiet hospital break room, a young nurse from Portugal sat staring at her phone, her break long forgotten. Headlines flooded her screen. Leave wins. UK votes to exit EU. For her, it wasn't just another piece of news. It was personal. This decision, made by millions she'd never meet, would ripple through her life, her career, and the place she called home. Across the country, thousands of healthcare workers from Europe felt the same knot of uncertainty tightening in their stomachs. What would happen to them, to their patients, to the NHS? Fast forward 7 years, and the answer is as complicated as it is sobering. Today, we're unpicking the promises made, the challenges faced, and the realities the NHS now battles every single day. It was a campaign slogan that burned itself into history. We send the EU 350 million a week. Let's fund our NHS instead. Bright red buses, plastered with this promise, rolled through towns and cities, igniting hope and anger in equal measure. The idea was simple: take the money spent on the EU and funnel it into nation's lifeline, the NHS. For many voters, this was the clincher, the reason to leave. But here's the thing: that 350 million was never real. After adjusting for rebates and EU investments back into the UK, the actual figure was far less. And even if it wasn't, Brexit didn't mean those funds could seamlessly switch from Brussels to Britain. Economic forecasts now show that Brexit has shaved around 4% off the UK's GDP. Less growth, less tax revenue, and ultimately less money for public services. To make matters worse, preparing for Brexit drained billions from the NHS. Stockpiling medicines, adjusting customs procedures, training staff for new regulations. All necessary, all expensive. Before Brexit, medicines and medical devices flowed freely across EU borders, thanks to a shared regulatory framework. Supplies arrived just in time, with minimal paperwork. Post-Brexit, however, custom declarations, regulatory checks, and border delays became the new reality. Stockpiling medication wasn't a choice, it was a necessity. The government directed the NHS to secure 6 weeks' worth of critical medicines to guard against border disruptions. This included everything from insulin to cancer treatments. The cost? Billions in additional spending, straining a system already stretched thin. Statistics from 2019 show that 75% of UK medicines relied on EU supply chains, making these preparations essential to avoid catastrophic shortages. Take insulin as an example. The UK imports all of its insulin, a life-saving drug for over 400,000 diabetics, from the EU. Any delay at the border could mean life or death consequences for patients. So, warehouses were filled, logistics staff were trained, and emergency plans were drawn up. But this level of preparation came with a price. Funds that could have gone to the frontline care were instead diverted to contingency measures. What once took hours, a seamless flow of goods across the channel, now took days, even weeks. Custom forms had to be filled, fees paid, and inspections passed. It was a system designed for control, but at the cost of efficiency. And for the NHS, efficiency wasn't just a nice to have, it was vital to saving lives. Let's now talk about the people. Before Brexit, over 30,000 nurses and midwives from the EU worked in the NHS. They were the backbone of wards, clinics, and surgeries. By 2019, nearly 5,000 of them had left. Officially, they cited personal reasons. But unofficially, many felt unwelcome. The anti-immigration rhetoric, the uncertainty about their status, and the complex new visa rules were too much. The loss of these workers wasn't just about numbers on a spreadsheet. It meant missed appointments, stretched shifts, and exhausted staff. Across England, 11.8% of NHS posts now sit vacant. Scotland's shortfall? It's 9.8%. This isn't just a staffing issue, it is a patient care issue. So what about recruitment, you might ask? Well, post-Brexit, the NHS turned to countries outside Europe. India, the Philippines, Nigeria. But this raised an ethical question. By solving its own problems, was the UK draining healthcare talent from nations that needed it just as badly? Brexit didn't just disrupt people. It disrupted supply chains. Medicines that once flowed freely across EU borders were now subject to custom checks. Some shipments faced delays. Others saw costs rise. To prevent shortages, the NHS stockpiled 6,000 types of medication. It worked, mostly, but at what cost? Billions of pounds that could have gone to the patient care were swallowed up by contingency planning. And then there's a matter of regulation. Before Brexit, the UK was part of the European Medicines Agency, a system that streamlined drugs approval. But now, the UK must go at it alone, creating potential delays in accessing new treatments. Every department had to adjust to Brexit. From new immigration policies to loss of the European health insurance card, the changes were constant, exhausting, and often unclear. And then came the pandemic.
China has identified the cause.
Brexit hadn't even settled when COVID-19 hit. The NHS, already grappling with staff shortages and funding pressures, faced its greatest challenge in decades. Nurses worked double shifts. Junior doctors protested stagnant wages. Brexit wasn't just the sole cause of these issues, but it amplified them. Like a crack in the foundation that gave way under the weight of a storm. Brexit was sold to us as a fresh start, a chance to take control. But for the NHS, it has been anything but. The funding didn't materialise as promised. Staff walked away, leaving critical gaps. Medicines became harder and costlier to secure. And the cracks it exposed? They are still there, growing wider every day. So, where does that leave us? The NHS isn't just a system. It's people, it's patients, doctors, nurses, porters, pharmacists. And their resilience is what's keeping it alive. But resilience alone isn't enough. If NHS is to survive, to thrive post-Brexit, it needs more than promises. It needs action, investment, and honesty about what it takes to rebuild. This is more than a story about Brexit and the NHS. It's a reminder of the power of compassion and resilience. Aneurin Bevan, the founder of NHS, once said, "No society can legitimately call itself civilized if a sick person is denied medical aid because of lack of means." That principle still holds true. Through every challenge, the NHS has stood as a testament to what we can achieve when we come together for the greater good. Let's honour that legacy and ensure it endures for generations to come. Thank you for listening. Also, please don't forget to like, share, and subscribe to this podcast on your preferred platform. Until next time, stay safe, folks.